Coronavirus booster shots have cleared another hurdle in the U.S. A CDC panel has recommended a third dose for people 65 and older, as well as some Americans at higher risk of severe infection. The decision is still awaiting final agency approval. This comes as the country's top medical official warns that the U.S. could be facing a, quote, dark, bad winter. But Dr. Anthony Fauci says it could be avoided with vaccinations. Omar Villafranca reports.
Motion passes.
Tonight, a CDC advisory panel cleared the way for a booster shot of the Pfizer vaccine for tens of millions of Americans once they're 6 months past their second dose. The CDC still needs to sign off before boosters can officially be administered.
And the ayes have it, and I believe this recommendation is adopted.
Under today's new guidelines, the booster is available to Pfizer recipients who have been fully vaccinated for at least 6 months, are 65 or over, or 18 through 64-year-olds at high risk of getting severe COVID. Those include individuals who are overweight or obese, those with diabetes, or pregnant women. The most common side effects from the third dose are similar to those from previous doses.
Is there enough evidence that this third booster shot from Pfizer is safe?
Well, most of the information we have from the third booster is from Israel, where this practice has been underway for a number of weeks. And so far during that time frame, yes, it seems to be.
Dr. Peter Hotez is with the Baylor College of Medicine.
It's really important not to go rogue and to do this with the recommendations of both the Food and Drug Administration and the Centers for Disease Control. But I think it's very important to get that third immunization after a 6 to 8 month period, because we are seeing a lot of breakthrough infections, breakthrough hospitalizations.
The Texas State Fair starts tomorrow, an event that attracted more than 2 million people pre-COVID. This year, by the midway, they'll be offering the Pfizer booster. A decision on the Moderna and J&J booster is expected soon. Lana?
Omar, thank you. For more, I want to bring in Dr. Bhavna Lall. She's a clinical assistant professor at the University of Houston College of Medicine. Dr. Lall, thanks for being here. As we just heard, a CDC panel voted in favor of booster shots for people aged 65 and older, as well as those with underlying health conditions. What do you make of this decision? And can you also elaborate a bit for our viewers about what conditions might fall under this umbrella of of people who are potentially at risk of serious complications?
Sure. Thanks so much for having me. So as discussed, the Advisory Committee on Immunization Practices met over the last 2 days. And the recommendations that they had were anyone over the age of 65 who's received their last Pfizer dose 6 months ago could get a booster, and also anyone living in long-term facilities. Also, people aged 50 to 64 with underlying medical conditions, and anyone aged 18 to 49 with underlying medical conditions in consultation with their doctor. So these underlying medical conditions could include diabetes, heart disease, certain kinds of lung diseases, obesity, pregnancy is also one of these categories, and other underlying conditions that would increase your risk of severe COVID-19.
So what needs to happen next before those who are eligible can actually get a booster shot?
So after this meeting, tomorrow, CDC, the next vote goes to CDC. So the director of CDC now has to take all this information under consideration from the FDA and from the Advisory Committee on Immunization Practices and come up with a recommendation based on all of this. And hopefully we'll have news by tomorrow to discuss next steps and get these boosters into those who qualify this week or next week.
And do you think that otherwise healthy individuals under the age of 65 will need a third shot at some point? And when might that be?
So I think we learned a lot over the last couple of days and weeks. We know that what this is based on is evidence, and we have to look at the data. And based on what has been happening and the data that we know from Israel and from other countries, the immunizations that are needed are in those that are elderly, where the immunity might be waning. And for now, I think we should go with the evidence, and as ACIP and FDA has suggested, that the evidence is with the elderly, with the immunity that's waning in the elderly population. And those with chronic diseases who are at higher risk for COVID would qualify for this. But at this point, based on what the data is showing and what they are recommending, not everyone needs a third dose vaccine right now.
So, Dr. Lall, we're still waiting for approval of a pediatric vaccine, which we understand could come next month. But the head of the National Institutes of Health says that children aged 5 to 11 may not be fully vaccinated until December. This means that young kids likely won't have protections for the upcoming holidays like Halloween and Thanksgiving, not to mention in school right now. So how dangerous is all of this, and how can parents best protect their children?
So yeah, I think this is something that's on every parent's minds right now. What we are seeing over the last couple of weeks, as we saw last week, 26% of all COVID cases were in children, and many schools have had to close over this, and teachers are concerned, students are concerned. So I think what we really need to do, as many have been saying, we need to make sure that people are wearing masks in schools. There should be mask mandates for populations, and also vaccines there should be vaccine mandates for schools where teachers are able to get vaccinated, and also for students as well. If they're age 12 and over, they really should be getting vaccinated now. If we can get more people vaccinated before the winter, hopefully we will not have more cases that will look like the surges that we just had a couple of weeks ago that are still continuing in many parts of the country. So it's really important before the flu season starts and before it gets colder in many parts of the country that we get more people vaccinated, and also the 70 million people currently that haven't even received their first dose vaccine. So I would continue to encourage teachers to get vaccinated, students to get vaccinated if they qualify under age 12 and up, and continue to wear masks in schools and continue to social distance for those children that still have not gotten their vaccine, especially as well.
Well, and you bring up the winter, and Dr. Anthony Fauci says that the U.S. could be looking at another, quote, dark winter. Tell us, what are you anticipating all of this could look like, and can it be avoided?
So yes, I think why they're saying this is because it can get avoided. If we can get more people vaccinated, as I said, there's 70 million people that still haven't gotten their first shot in America. If we can get more people vaccinated in the next couple of weeks, as Dr. Fauci was saying, we need to try to avert this next surge that could happen in the next couple of months. And what we need to really emphasize is that these vaccines are safe and effective. We have them available. You can easily go to your pharmacy or to your local hospitals offering these vaccines and get the vaccine so that we don't have to face this winter with holidays coming up and all of this happening during this, having another surge happen within another couple of weeks. So we really want to make sure that people get vaccinated right now and also get the flu shot as well. With this combination of flu and COVID coming up, this really could be a bad winter if we don't get these vaccination rates up. Right now, we still have only 55% of the country vaccinated. So we really
I was going to say, a good reminder, too, on the flu shot, especially since some of those symptoms can look the same as COVID. It helps all of the medical professionals like you keep a better handle on the situation. All right, Dr. Bhavna Lall, thank you for joining me, and thank you for all that you do.
Thank you for having me.